golfers is hip pain. And we see different types of hip pain in golfers. Sometimes we see lateral hip pain, sometimes we see anterior kind of groin pain, and sometimes we see it more in the buttock or in the posterior hip. And so differentiating that for the clinician can be challenging to do, and then trying to figure out what mechanics in terms of golf could be leading to that. We want to try to figure out so that the person avoids the pain as well as prevents it from returning. So we'll first talk about the lateral hip pain, because I see that pretty often in terms of golf. So when we're actually performing our golf swing, it should be a rotary movement. We're rotating on the backswing, we're rotating on the downswing. So we have a nice coil on the backswing, and that we have a nice rotary and coiled position on the downswing. A lot of people just don't really know how to rotate very well, and so we get what's called more lateral movement. So on the backswing, we have what's called a sway. So she actually sways out of kind of her starting position, out of her base of support. Maybe the right foot kind of rolls out a little bit, and that hip, because it's kind of pressed out laterally, it puts a lot of stress on the outside of the hip. Those tendons, those muscles coming from the glutes or on the outside of the hip can get overstretched, and eventually start to lead to some tendonitis or even some partial tears. And that's of the trail hip. The other thing that we see is we can see lateral motion in the downswing. So when you come in the downswing, we should see that nice coiling movement. We're finishing solid on the left side. But if we start to see some more lateral movement, we may see that left knee kind of buckle out. She slides away from or towards the target too much. That left foot may roll out too much. And again, putting some stress on the outside of the left hip or even the left knee there. So we want to So one of the things that we'll work on in terms of mechanics is being able to rotate properly. Now, when we assess her, we want to see, is she doing that lateral motion because she's lacking mobility, or maybe she can't actually rotate her hips because she's lacking some motion, or is it because of a stability problem, meaning she has the motion to rotate her hips, she just doesn't really know how to so well, so she tends to move side to side as opposed to that coiling action with that. Balance may also be an issue, so if she's not able to really balance on her right side, well, she may kind of roll out with that a little bit, or kind of fall back onto the left side because her balance isn't great and she's not able to fully weight shift from right to left. So we want to assess that to see, is that one of the causes of the pain, and particularly that lateral hip pain. The other thing that we see in terms of hip pain is more that anterior hip pain or that groin pain. And it's pretty common in golfers, particularly since it's such a rotary sport. We're utilizing our hips a lot for rotation, and so they need to be nice and mobile to accept the demands of the swing. If people are lacking any sort of motion of their hips, and so they're stiff, they're lacking particularly what we call a hip intern rotation, so their ability to turn into their hip on the backswing, turn into their hip on the downswing, we start to see where that hip joint just starts to kind of grind on itself, and we can get some breakdown of the cartilage or even of the labrum of the hip because it's lost some of that motion. So we want to make sure we evaluate that to see, is it a lack of motion that can be causing that. If that's the case, we're obviously going to work on our hip mobility, but another kind of easy fix that someone can do is just even in their setup posture, if we find that they're lacking some hip motion, we can just have them turn their feet out a little bit. So that's going to give them more relative motion in their backswing, more relative motion in their downswing, as opposed to that squared, or sometimes even I see people that are kind of toed in stance, because that's going to limit you a lot more, put a lot more stress on the inside of the hips, as opposed to more of that toe out position with that. So lots of different causes for hip pain. Again, it's important to be evaluated to see where's the pain coming from. Is it coming from the hip joint? Is it coming from the muscles at the side of the hip? Is it even coming from the back? Sometimes back pain can mimic as hip pain. So really getting a good quality evaluation to figure out the cause of that. And then is it because of lack of mobility? Is it because of lack of stability? Is it because poor golf mechanics? And start to kind of figure out from there. It's one thing to calm the pain and get the person pain free, but can we prevent it from coming back once they get back on the golf course?